Hello, everyone. Welcome to today's webinar hosted by the Asian Development Bank in collaboration with socialprotection.org. Today, we will discuss linkages between social protection and nutrition and explore the premise that strengthening social protection can lead to better nutrition outcomes. And our participants will bring their perspectives from their research and their practical experience from their work in their countries. Now, my name is Bob Babajanyan, and I'm a social protection specialist at the Asian Development Bank. And I'm pleased to share that today's webinar is the first of the series of webinars that the Asian Development Bank has launched in collaboration with SP.org. And this series are themed Rethinking Social Protection, Inclusive, Adaptive, and Future-Ready Systems. So as part of this series, we will introduce a number of different topics, and we will touch upon innovations and challenges faced by social protection systems, discuss practical insights and solutions to these challenges. And we will explore a wide range of topics, including adaptive and shock responsive social protection, economic inclusion and active labor market programs, integrated social care for disadvantaged groups, and many more. So please watch this space, and we would welcome your participation in these webinars. I should also mention that in partnership with SP.org, ADB is relaunching the online Asia Pacific community, which has existed on this web platform, but we'll be relaunching it, and it will provide more information about how to register and how you can participate and contribute to this community, and use the community as an entry point for exchange, discussions, and interaction with like-minded individuals across the whole region. Now, moving on to our session today, just to give you a very short background to the topic. So we'll, as I said, we will explore how countries in the region, in the Asia-Pacific region, are integrating nutrition outcomes in their social protection programs. And now we do know that the region has a long history of social protection policies that aimed at addressing diverse needs of vulnerable population, including population who suffer from malnutrition and food insecurity. And many countries have indeed integrated multisectoral strategies to deal with food insecurity and malnutrition. And in these strategies, social protection is increasingly playing a greater role. And there's a greater recognition that social protection can be a very powerful instrument in combating malnutrition. Now, the level of integration, however, varies across different contexts in Asia Pacific. As the participants today will share, there is a greater need for employing social protection for addressing not only a sort of broader economic and social deprivation, but also specifically nutrition-related vulnerabilities. So with that introduction, let me give you a brief introduction and present the housekeeping rules actually before I move on to the speakers. So a few essentials to remember. So today's session will be recorded, and the recording along with the presentation will be available on socialprotection.org. It will also be sent to all those who registered for this session. Now you can use the chat box to introduce yourselves and to make comments and to share links to useful websites. But please remember, if you have a question to one of those our speakers, please use the Q&A box for that. So when using the Q&A function, please state your name, your organizational affiliation, and be specific. So please direct your question to a specific participant, or if you're referring to a specific point of view, please mention that. So contextualize your question so that the moderator, when picking up a question, knows whom to direct your question, and so that the speakers can actually address it really more effectively. Now, the Zoom AI also generates automatic captions, and to see to see it, click in the CC closed captions button. So that's all I have for the housekeeping. And just to also give you an introduction on the session flow. So there will be a presentation on the linkages between social protection and nutrition, and will take about 15 minutes to go through the presentation. Then we have a panel discussion, a 40-minute panel discussion involving 3 speakers, and there will be 20 minutes for the Q&A, and we do encourage you to post your questions in the Q&A function. And with that, we will close and wrap up the session and draw some conclusions. Now, so let me introduce the presenters. So with us today is Richard Morgan, who is Director of Social Safety Net at Nutrition International. And Richard will say a few words about Nutrition International, which is an international organization that dedicated itself to dealing with food insecurity and malnutrition. Our panel moderator is Juanita Vasquez, who is Chief Social Policy Officer at UNICEF Malaysia. And our distinguished panel speakers are Mr. Bika Ahmed, who is Director of Conditional Cash Transfers at Benazir Income Support Program, or also known as BISP, that has been funded by the government of Pakistan. We have with us Dia Lengogeni, who is Director for Health and Community Nutrition at the Ministry of National Development Planning and National Development Agency of the Government of Indonesia. And we have Mr. Amil Jilani, who is Senior Social Sector Economist at the Asian Development Bank. So we have a very rich, we expect a very rich panel with our participants sharing rich insights from their experience, and we're looking forward to their presentations and their insights. So with that, I'm handing it over to Richard for his presentation on social protection and nutrition. Thank you very much, and over to you, Richard.
Thank you so much, Bob. I'm just sharing the presentation. Good day, everybody. Pleasure to be with you and excited to be part of this webinar, looking at the links between social protection and nutrition, and in fact, how social protection programs and national investments in them can generate greater results for improved nutrition. I'm delighted to be presenting the findings and recommendations from work done jointly with the Asian Development Bank, and I particularly want to thank Bob and Amir for the collaboration on a series of joint policy briefs. There are actually 2, a shorter version and a longer version. Participants will receive the links to these in the chat during the course of the webinar. So I'll go through these, but again, really grateful for the collaboration with ADB. And I think before I start, just to make a point about the vast differentiation that is found in rates and patterns of malnutrition or good nutrition across both Asia and the Pacific. So this presentation will be at a high level of generalization, and then we'll dive into the specific examples with our panelists at country level. Just a word on Nutrition International. Bob was kindly mentioned us at the outset. Those of you who may not know us, we're based in Canada, in Ottawa. We've worked for over 30 years as an expert ally to governments, including in Asia and also Africa and other regions, primarily providing technical expertise as well as nutrition commodities to help countries deliver nutrition-focused interventions at scale. So part of our approach in social protection, which is a relatively new area for us, is to look at national programs and where are the opportunities for generating improved nutrition through national spending on social protection, where are the gaps, and how can Nutrition International support governments through expert technical assistance to capitalize on those opportunities. So we've been promoting a number of policy dialogues with countries around the Asia region through our country offices and country programs, as well as in conjunction with partners, including the ADB. As a background, I think as most participants know that in many parts of Asia, as well as the Pacific, rates of malnutrition, such as young child stunting and wasting, rates of micronutrient deficiencies, particularly among girls and women, are still high. Really varies a lot depending on country, geographies within countries, population groups, age groups, and so on. But in general, I think Asian governments still see rates of malnutrition, including rising levels of obesity in some cases, as major challenges, both to human development and to human rights. As against this, social protection programs, based on the mounting evidence from around the world, including in Asia, show great potential if well designed and targeted for helping to reduce malnutrition among vulnerable populations, both malnutrition arising from structural factors and from shocks and emergencies. So that evidence in Asia shows that well-deployed social protection programs, if designed with this in mind, can in fact prevent and reduce malnutrition, and they provide multiple opportunities, both for addressing expected goals like poverty reduction, improved household food security, but also addressing malnutrition. The two policy briefs, both the longer and shorter version, arise from background work that Nutrition International undertook through a scoping review. This focused on 14 countries in Asia, but also looked more widely in the region at the literature, the evidence, over 40 key informant interviews, including with development partners in the UN system, ADB, as well as, of course, in national governments. And this resulted in case studies at country level and thematic panels that looked at some of the best examples of national programs where countries are seeking intentionally to integrate nutrition elements within social protection programs. And based on this background scoping work, ADB and Nutrition International have produced the two policy briefs that we'll be looking at today. The policy landscape, and Bob has already referred to this, there is a long history of social protection programs in the Asia region. A number of countries, since inception of their development policies, have looked at social protection programs, including safety nets, but also other types of interventions, as a way of addressing poverty, building human capital, stimulating economic growth. Increasingly, there's been a realization that these human capital goals need to include measures and designs that address the deep-seated problems of malnutrition that many countries and populations are facing. And the multisectoral nutrition strategies that most countries in Asia and the Pacific now have developed do almost always include social protection. This we found from our scoping review. Conversely, however, in the social protection sector, the strategies for social protection less frequently take account of nutrition and incorporate nutrition goals. So that is a gap, but also obviously an opportunity for strengthening the focus of social protection on nutrition objectives and making progress. The gaps also include wide variations in coverage. These are some illustrative examples of expenditure as a percentage of gross domestic product on social protection, a wide range. These are not the most recent estimates, but they give an idea of the variation. This doesn't say, by the way, anything about the efficiency of expenditure. So quantity goes hand in hand with quality, of course. So results can be higher even for countries that are spending relatively less of their national income on social protection. But where there's policy fragmentation and there's not joined up policies, for example, between social protection as a sector, the health sector, the agriculture and livelihood sector, for example, the wash sector, there tends to be less impact because the synergies are not being taken advantage of. Also, as we found in our work, the targeting of social protection measures to poverty is not sufficient on its own to take account of nutritionally vulnerable and affected populations. In other words, poverty and malnutrition, while they overlap considerably, do not entirely substitute for each other. In other words, there can be significant levels of malnutrition among populations who are less poor, households who are in the upper income groups, as well as those who are the poorest. So poverty targeting on its own is not necessarily the most efficient for addressing malnutrition. Just take a moment here using the UNICEF-originated causal framework for understanding the drivers or determinants of malnutrition. These are at different levels of society, at household level, community and local level, at national level, even international factors like shocks that affect nutritional outcomes. And the very fact that there are so many underlying determinants that can affect malnutrition, such as food availability, but also the use of food in the household for feeding and care practices, access to health services, clean water, and the distribution of resources, both in terms of gender-based inequalities and economic inequalities. All of these factors necessitate looking at malnutrition through several different sectors, of which social protection is one. Typically, we've found across the world and in Asia that addressing only one sector is not sufficient to achieve results for improved nutritional outcomes. So that being the case, if we take the example of social protection, up there in the upper left-hand corner, you see cash transfers, in-kind transfers, such as food supplements to households, working their way across through different pathways in order to, on the right-hand side, reduce child stunting. So the relationship between, let's say, a cash transfer to a household that is poor and vulnerable is not a simple one when it comes to reducing child stunting. It would need to typically increase access to food, help improve feeding practices, breastfeeding and complementary and weaning practices in the household, the way children are cared for in early childhood, and improving the access to clean water and the use of health services where they exist locally. And typically, cash and food transfers do help improve these intermediate pathways that can result in improved nutrition. But what we see here as well is that cash, food, and other measures on their own are not necessarily enough, again, to improve nutritional outcomes. There are complementary measures that need to be taken, such as nutrition education to promote the use of health services, the purchase of nutritious foods, and improved breastfeeding and weaning practices for young children. So in our policy briefs, we've classified social protection programs as nutrition sensitive when they include three things: goals that are nutrition focused, components which address those drivers of malnutrition that we've just looked at, and indicators that monitor whether progress is being made to reduce nutritional outcomes and improve those pathways, like improved diets and feeding practices. And in the policy briefs, we've looked at three of the main types of social protection interventions. As I've said, cash-based transfers, cash supplements, food-based transfers that would include both food physically, but also food vouchers, which are used in parts of Asia, and school meals as well, school feeding programs. Those are the three main types that we looked at in the study. So looking first at cash-based transfers, we found many opportunities based on the available evidence globally and in Asia for improving the nutritional impact of these transfers. Firstly, addressing targeting and coverage issues Coverage not only households that are eligible for cash transfers, but also the level of the cash grant that's provided, which needs to be sufficient to make a difference to help households to meet their nutritional needs. Targeting as well to families, for example, where women are pregnant and families with young children who are in a particularly nutritionally vulnerable age. Secondly, combining cash transfers with nutrition messages, information to households, and encouraging families to make use of the cash transfers for purchase of nutritious foods. Thirdly, co-delivering together with the cash needed interventions on public health grounds like micronutrient supplements and small quantity food supplements for young children where needed. Fourthly, where there are conditionalities, using these in a promotive way, not a punitive way, to encourage families to make better use of local health services such as antenatal care for women in pregnancies, to get immunizations, to undertake regular growth monitoring of young children to see that they are growing well. Cash transfers can encourage and be linked to these services. And then lastly, building these kinds of interventions into the design of cash transfer programs, including clear goals and indicators of impact and progress. When we look at food-based transfers, provision of food and food vouchers, the opportunities are very similar. Again, we have nutrition-specific interventions like micronutrient supplements and lipid-based food supplements for young children, nutrition information combined with the food transfer, and including nutrition in the program design. The one that is more specific to food-based transfers is the first one there, which is ensuring that the food provided or covered in the basket that's provided by the voucher does include balanced food basket and fortified and nutrition-rich foods, not necessarily basic staples alone, but fortified food products. And finally, the third area is school meals. This is quite a complex area. So just to give a flavor, school meals are primarily, of course, an education-focused intervention, one that can encourage children to enroll and to be kept in school and to learn well in the classroom because they are not hungry, but also address food security needs at the family level who can't necessarily afford all meals in a day, and the provision of one meal at school is very helpful. But school meals programs only appear based on the available evidence to have nutritional impact if and where they're combined with in-school health and nutrition programs, such as iron supplementation, deworming where needed, clean water interventions, hygiene education, can be particularly effective in addressing anemia among school pupils. Girls in particular, in many parts of the region, still have high rates of anemia, and school meals can be used linked with health programs and supplements to address these. School meals can also bring in wider communities, including out-of-school children, and countries in Asia are experimenting with reaching out-of-school children, including adolescent girls, through school meals programs and increasing community awareness through engaging families of children in school in the preparation of meals and combining that with nutrition education. So there is strong potential in school meals, but very often they're seen as a nutrition intervention, whereas in fact the design is not strongly oriented as yet to addressing malnutrition among adolescents, for example. Couple of cross-cutting issues that the policy briefs highlight. One I've already mentioned is the need for nutrition-focused targeting, linked together with poverty targeting, which is much more common in terms of cash and food transfers, because poverty targeting alone will tend to miss out many families who are either nutritionally vulnerable or who have children and mothers, women who are already affected by malnutrition. So that we're suggesting a combination of poverty and nutrition targeting for beneficiary selection. There are also major gaps in monitoring as well as evaluation of programs for their nutritional impact. Monitoring schemes and frameworks for social protection should more frequently include nutrition-related indicators along those pathways that we looked at before, such as dietary quality, feeding practices, and the use of local health and nutrition services, as well as outcomes such as reduction of anemia, wasting, and stunting. So those are two of the program design issues across a number of schemes that we saw were missing or potentially inadequate for obtaining major nutritional impact. Finally, of course, just to summarize, what I would stress is that whereas social protection programs do have strong potential for addressing, preventing, and reducing malnutrition, they work best when there's an intentionality, when they're intentionally designed by governments across sectors as well as funding partners in order to achieve nutritional objectives. Again, building in these objectives at the level of goals, linking transfers of cash and food and school meals provision with nutrition-related components based on the analysis of what's driving malnutrition, reaching out to include and make sure we don't exclude nutritionally vulnerable populations, looking at the synergies between sectors such as enriching foods and linking health and social protection as well as agricultural and livelihoods systems. Increasing coverage, of course, is something we support from a nutritional perspective, not only because it's a good thing in itself for vulnerable families to be able to benefit from social protection programs, but because this provides a foundation for nutrition interventions and to address both poverty reduction goals and nutrition improvement goals at the same time through coordinated programs. So the multisectoral coordination, last point there, is essential to seizing these opportunities for generating impact through improved pathways to better nutrition. So those are some of the conclusions from the joint policy briefs produced by Nutrition International and the Asian Development Bank, and these are available at the links you see here in the last slide, both on both our websites, and these will be made available. So thank you very much, and I'll hand back from here.
Thank you, Richard, for this rich presentation. We will now move to our panel discussion, but to those listening, feel free to ask questions or comments in the Q&A box, and we will have time at the end of the panel to pick these up again. So just allow me to reintroduce our panelists today. We have Vasquez Ahmed, Director of the Conditional Cash Transfer Program, BISP, from the Government of Pakistan. We have Dia Lengogani, who's the Director for Health and Community Nutrition for the Ministry of National Development Planning, National Development Agency from the Government of Indonesia. We have Amir Dilani, who's a Senior Social Sector Economist from ADB. So we'll do 2 rounds of questions today. The first round will explore what it takes to embed nutrition into social protection in the design phase. So basically how nutrition objectives have been integrated into social protection strategies, what has worked and what challenges were encountered in the program design. And in the second round, we'll shift gears a little bit and we'll dwell into implementation realities, really, the effectiveness, monitoring, and what it really takes to have impacts and scale. So maybe let me give the floor and start with Mr. Vasquez Ahmed. So the first question for you is really, how has the Benazir Income Support Program approached the integration of nutrition into its social protection framework? What were some of the key design considerations or trade-offs you had to manage? Over to you.
Thank you, Juanita. Benazir Income Support Program is actually the largest social protection program of the government of Pakistan. Initially, when it was established in 2008, it only started off with the unconditional cash transfer programs. And then later in 2012, it started off another conditional cash transfer program, which was linked with education. And then in 2020, a life cycle approach was adopted, and then this nutrition program was started off in few districts as a pilot program. Later, this was nationally rolled out in 2021, and now we are operating across Pakistan, excluding those districts where the provincial government is executing some nutrition programs. Yes, as I said, this had to adopt a life cycle approach by integrating this nutrition intervention into their existing cash transfer programs. This presented a significant evolution from the unconditional to conditional cash transfer programs, specifically targeting the critical 1,000 days window from the conception to a child's second birthday. The integration strategy leveraged the base existing national socioeconomic registry, which is the largest registry, the socioeconomic registry in Pakistan, and is used for targeting purposes in all our programs. So this took up the same registry, and then the unconditional cash transfer households, which were at the time around 6 million households. So they were eligible for this enrolling in this nutrition program. So it provided a cost-effective and a scalable approach rather than creating parallel systems. Coming to the design considerations that BISP had to make while integrating this nutrition program into its programs. First one, we had to go for the targeting, and as I said, the same database was used for targeting the nutrition program, which was used for the unconditional cash transfer program. So it built upon the existing database that we had. And then specific eligibility criteria regarding the pregnancy and lactation and the child age was considered. And ultimately, all of them were included, like a pregnant woman or a lactating woman or a child under 2 years of age can be enrolled in the program in whatever trimester they are in. But we now encourage the household or the beneficiary to enroll in the first trimester of their pregnancy. And then for the verification purpose, we had to rely on the National Database Registration Authorities database, which is another which issues the national identity cards. So we had to rely on that for the verification purpose. And then the conditional framework was designed in such a way that it had 4 conditionalities associated with this cash transfer on nutrition. Number 1 was the consumption of the specialized nutritious food. They are issued 90 sachets for 1 quarter, and they have to consume 1 sachet per day. And in the follow-up visit, they have to bring those back, those empty sachets, and at least they must consume 81 sachets during that time. So this is the first condition. Second condition was to attend to the awareness sessions which were conducted at the facilitation centers on each visit, follow-up visit. Number third condition was they have to complete the immunization package for their child. Number 4, they have to be regular in their visits, whether they are ANC or PNC visits. So these 4 conditions were embedded in the eligibility criteria. And then we had a multisectoral coordination approach to this program as well, because this lacked the technical expertise in nutrition. So we had to partner with the World Food Program for the implementation because we had to leverage their technical expertise. And then later we engaged in the UNICEF for the SBC component, and then the WHO for the CMAM treatment. Later, we also established monitoring mechanism through the facilitation centers. We also partner with the provincial government, because we had to use their health facilities. They provide a space within their hospitals. So we signed contracts with all the provincial governments as well. And now, this is operating in 550 facilitation centers across Pakistan. Then coming to the trade-offs that BISP had to make during this process, the critical trade-offs. One was the complexity and impact. Of course, for the unconditional case transfer program, we didn't have any complexity regarding the compliance. But for the conditional case transfer program, you have to verify the compliance, and you have to do the monitoring and recording of the compliance. And then so that we did adopting the technology, and we had to develop an Android application, specific Android application for the nutrition program, on which we really make it easy for data collection as well as monitoring and evaluation. This enhanced the accountability and ensured specific nutrition outcomes. Regarding the coverage versus depth, BISP had to intensive intervention for the broader coverage through strategically targeting the vulnerable population within that 1,000 days window. The 1,000 days that I'm referring again and again to is from the conception to a child's second birthday. Then the existing systems versus new infrastructure, we also have to look at that as well. So we adopted the existing eligibility criteria, and we didn't have to establish a new eligibility framework. So we leveraged the unconditional database, and then the existing system and the new infrastructure regarding that, we adopted the existing system, and then we added specific health related intervention, health related eligibility criteria in that. And for the infrastructure, as I said, we signed MOUs with the provincial government so that we can use their premises for providing this facility for the enrollment and follow-up visits.
Thank you, Mr. Ahmed. Would you be able to summarize your last points in a few sentences?
Okay, fine. Yeah, I'll read the final point. Okay, so the government capacity, BISP also had to build its own capacity as well as to leverage the partners' capacity in implementing this. So and then this made the knowledge transfer possible while ensuring immediate implementation quality. So that's all. Thank you.
Thank you so much, Mr. Vikar. Maybe now let me move to Ms. Dia Nenggogani. Let me start with, so Indonesia has extensive experience in multi-sector coordination. How has the government ensured that nutrition goals are prioritized within broader sectoral priorities, including social protection? Over to you, Ms. Dia.
Thank you, Juanita. A very good day, everyone. So thank you for giving me the chance to share experience from Indonesia. So Indonesia has learned over time that nutrition is not just a health issue, it's also a development issue. And Indonesia would like to ensure that nutrition goal to be prioritized, and the government has worked diligently to bring various sectors together and foster a shared understanding that good nutrition is essential for the country's future. At the national level, nutrition is integrated into National Development Planning document. We have the Long-Term National Development Plan 2025-2045, and it's being detailed into the medium-term National Development Plan 2025-2029, and we have the annual planning that also interpret the detailed intervention into a yearly plan. So in the midterm development plan, we have this trident development agenda that emphasize three primary targets: reducing poverty, enhancing the quality of human resource, and promoting economic growth. So the president and the vice president, we have the 8 aspiration, which aim at the national independence through food self-sufficient, strengthen health development, promote economic equity, and eradicate poverty, is a combined concept that need to be achieved by all sector. And with the document, especially for the nutrition aspect, we mentioned that nutrition is essential and it's part of the component of the health system, but also for the food system, because we have the law on health that includes effort to fulfill nutrition needs in low-income families. And we have the food law that emphasizes improving nutrition in food and nutrition insecure groups. So both law view vulnerable groups, especially low-income family, as target that require special attention. So therefore, the government has developed an adaptive social protection system that already include intervention relevant to nutrition improvement. But this program is not directly in the form of a nutrition intervention, but is aimed at low-income families to get nutrition assistance and education to become healthier and more productive individual. So other form of assistance that also provided within the social protection that is the responsibility of the Ministry of Social Affairs is the basic food assistance for the vulnerable or the poor community. It consists the fortified food assistance, but also support by the National Food Agency with the campaign on varied, nutritious, balanced, and safe food consumption, especially for low-income and vulnerable families. Another thing, the agenda of the government is also committed to conducting large-scale food fortification as one of the social protection instruments for the vulnerable community. The social protection intervention is also provided in the community in disaster condition, where the Ministry of Health has attempted to provide assistance to pregnant women and vulnerable group, also children under 5, if they are living in the refugee camp during the emergency condition, to get the special support to ensure that this group continue to receive nutritious food and health services at the disaster affected sites. So to support that, Indonesia continues to support the integrated nutrition intervention in Indonesia nationwide. Then the Ministry of National Development Planning Agency continue to use data and information from other development stakeholders. We prepare the evidence-based policy and also provide the multi-stakeholder dialogue to guide decision for the government to set the priority agenda every year. And we have the support from the Sun Movement and also other stakeholder platforms. So the government can create the space for the contribution of civil society, development partner, private sector, and academia to contribute ideas, align the effort, and also hold accountability of each other to make sure that our agenda is aligned and in line and can give a significant impact to the targeted group. I would like to add that now Indonesia is part of the School Meal Coalition team member, and we are preparing a very huge program of free nutritious meal, which will give the support to the school-age children the pregnant women and the breastfeeding mother, and also children under 5 as part of the social protection program in Indonesia. The main objective of this program is to fulfill nutritional needs and improve healthy eating habits by providing free nutritious meal for all the target group. And we also prepare the supporting ecosystem, because it's not only health and nutrition aspect, but the ecosystem where the kitchen, the schools, the primary healthcare can support that the objective of providing nutritious meal will comply with the standard, and then accelerate the target of nutritional fulfillment in Indonesia. So I think that's one of our priority for the next 5 years. Thank you very much.
Thank you, Ms. Dia. Amir, let me move to you. From your experience across Asia Pacific, what are some practical entry points where governments can begin to integrate nutrition more effectively into existing or planned social protection programs?
Great, thank you so much, Juanita. It's great to be here and to join my fellow panelists. So I think many governments across the region are looking to leverage their social protection programs to address issues of persistent malnutrition. And so from our experience, there are 4 practical and evidence-based entry points that offer very immediate and scalable opportunities for integrating nutrition into social protection programs. The first is, as was mentioned by Richard earlier, targeting and focusing on the first 1,000 days from pregnancy to a child's second birthday, because this is really the most critical window to prevent stunting and promote healthy brain development. Because we know that around 70% of stunting occurs before a child's second birthday. Now that still means that a third of stunting occurs, or a third of the total height deficit at the age of 5 is still accumulated after the age of 2. But even that reflects the long-term consequences of poor quality diets and illnesses in the first 1,000 days. And many of these are not preventable. So we simply can't ignore that window from pregnancy to a child's second birthday. And many countries in the region have social protection programs that are already targeting poor households. And so these programs can be adapted to specifically target pregnant women and young children. A few countries, including the Philippines, Laos PDR, Indonesia, Pakistan, and Bangladesh and India are planning or already have dedicated programs for children in the first 1,000 days. They differ slightly in terms of the package of interventions that they deliver, but we're seeing promising results already from many of these programs, including both on intermediate outcomes such as dietary diversity and healthcare utilization, but also longer-term outcomes and anthropometric outcomes, including stunting and wasting. The Indonesia example is actually really interesting because early results of the CCT program were quite modest, but when evaluators went back, they found that stunting among beneficiaries had dropped around 9 percentage points after 6 years. And so that reflected the importance of persistence and early life targeting. Often we're looking for quick results, and the nature of nutrition is that it can take time before you see results, at least on some outcomes. The second entry point is, I think, reviewing the design elements of existing programs, particularly benefit levels and the frequency of payments, to see if these are serving nutritional objectives. Often countries don't need to introduce entirely new programs or start from scratch just because existing programs are not delivering results. You sort of need to lift the hood and see what's working and what's not. So for example, one of our clearest lessons from work that we're supporting in the Philippines, from a pilot program of a new food voucher program that the Philippines government is launching, is that the benefit size really matters. We supported the government in first piloting electronic food vouchers across 5 geographic locations, where beneficiaries receive 3,000 pesos, which is around $50 per month. But then when you have a family size of 6 or 7, that translates to just 14 pesos per person per day, while the cost of a healthy diet is around 79 pesos per person per day. So even a well-designed program may struggle, I think, to improve diets if the transfer size is just not sufficient to close the affordability gap. And so that's why we're working with the government to test higher voucher amounts and introduce revised food voucher allocations. But I think it's important that the data on existing household expenditure on food is compared with the cost of a healthy and nutritious diet using locally available food prices to inform that decision making. The third entry point is pairing transfers with nutrition education. This was mentioned earlier as well, and in Bangladesh, they've seen really promising results where stunting went down by 7 percentage points in just 2 years by layering SBCC on top of cash transfers. This is similar to what the Lao PDR is now doing, pairing cash transfers with context-specific nutrition SBCC. And the last entry point, I would say, is making programs data-driven and grounded in evidence. Now, this is important because there's programs like India's midday meal program that have undergone significant revisions and changes over the years, but now show that significant improvements in child growth can be attributed to the program, and mothers of children who were part of the program are also seeing sort of improvements in their nutrition. So these are, I would say, the 4 key entry points that we've seen that can be leveraged to improve nutrition through social protection programs.
Thank you, Amir. And on that point, I just want to really emphasize that power of evidence. In Malaysia, we've been following the situation of households living in low-cost flats, since 2018, and have shown evidence of the connection between lack of resources and nutritional outcomes. And because of the latest one, we try to understand the cost or the impacts of the high cost of living and that relationship with nutrition. And we found that 50% of children in Kuala Lumpur, which is a high-income city, were eating less than 3 meals per day. And because we were able to really reach a large audience with this information, the Ministry of Finance allocated 5 million ringgit to pilot an integrated cash transfer and nutrition program that we're about to launch in August. So I think, really generating that type of evidence between the links of nutrition and social protection or availability of resources is really powerful. Let me now move to the second round of questions, where we're going to focus on implementation, scale up, and impact. So, Mr. Vikar, let me move to you. What have been key lessons from the VISP experience implementing nutrition-focused interventions, particularly in targeting, delivery, and uptake by beneficiaries?
Okay, thank you. There have been several lessons that BISP has learned. Like previously, as I said, BISP had only one conditional cash transfer program, which is linked with the education, but that is BISP is implementing itself that program. But for this program, we had to partner with the other UN agencies. So there have been a few lessons that we learned, talking about the targeting, as I earlier said, we relied or we leveraged the existing database, which was provided as an easy startup. So we didn't have to bother much about the earlier start of the program. So when the government approved this program, so in a few months, we were able to kick off the pilot. And then coming to as I said, the life cycle approach, the 1,000 days window, that maximized the impact during the most critical development period of a child. While choosing a time-bound approach is a strategic decision, like it was based on scientific evidence about when nutrition interventions have maximum impact, best implemented, the dynamic system to track and address the beneficiary status as their circumstances change within the 1,000 days window, like from pregnant to lactating and then to child. Regarding the geographic prioritization, BISP rolled out the program in phased manners, like piloted in high stunting districts first, which allowed for learning and adaptation and expansion phase. This also helped in balancing the political considerations and the evidence-based targeting. Regarding the delivery mechanism lessons, we also had a few lessons learned. The multi-channel service delivery like this established more than 550 facilitation centers across Pakistan. So this physical presence in communities is essential for behavior change programming. Moreover, integrated digital tools for real-time monitoring and database establishment, this also provided us like it was useful in implementing the program in an accountable manner. Partnerships with that also work for BISP, like as I said, BISP partnered with World Food Program, UNICEF, and WHO's technical expertise. Like we leverage their technical expertise, and which proves that the strategic partnerships can accelerate implementation while building internal capacity. Regarding the conditional cash transfer design, so linking these payments to specific behavior change, that improved the service utilization, and it proves that conditions must be achievable. That's the key. And the second thing is it must be supported by available service. Like during this program, we didn't make the ultrasound checkup mandatory because we had an idea that that facility is not available in all the provincial government hospitals. So any condition that we link to this program must be achievable. The beneficiary of taking the health facilities, we also had a few lessons from this program, like the social behavior change communication. This is critical. Comprehensive HBCC activities and campaigns that reach best beneficiaries enrolled in BISP and other community members through multiple channels. It was learned that financial incentives alone are insufficient, so knowledge transfer and attitudinal change is essential as well. And then you also have to look at the cultural and social barriers, like traditional practices and gender norms sometimes conflicted with the recommendation behavior. So, however, engaging family members, religious leaders, and male community influencers proved crucial for acceptance of the program within the community. So you have to work on creating an ecosystem which is like conducive for integrating such kind of starting off such kind of programs which are like quite sensitive sometimes in the community. Another like the service accessibility issues, the seasonal migration and remote locations, security situations, sometimes absence of functional health facilities that can affect the service uptake. So you also have to look at them as well. So these have a need for flexible service delivery models and mobile outreach units. You have to have those as well. And the operational lessons that we learn are like some of them are the capacity building requirement, comprehensive and systematic training of field staff and health workers play a crucial role in improving service delivery. And due to high turnover rates in some areas, requires continuous capacity building. Regarding the monitoring and evaluation systems, the real-time monitoring through the digital systems was the key in this program. It was the most salient feature of this program, which proves that a robust M&E system is essential for tracking both financial and behavior outcomes. And then the sustainability and scale-up lessons, like the government ownership through this program, which is like it's been only 5 years that we have this program. We have seen 3 governments changed in Pakistan, but all of them like they have accepted the ownership of this program, and we didn't have any problem in budget provision or any other thing that we have to take this program. So for that, like the financial sustainability, the key integration with existing budget cycles and systems that also demonstrated cost effectiveness and helped in securing continued funding. So that's from me. Thank you.
Thank you, Mr. Vikar. So maybe let me ask Ms. Dia, how does Indonesia monitor and evaluate the nutritional impact of its social protection programs, and what evidence has been most useful for informing policies and programming?
Yes. Well, actually, as I mentioned, because the Ministry of Development Planning Agency where I work, we have the regulation on how the monitoring and evaluation is done for the plan that is written within the development plan and how it was implemented. And then we see, we coordinate all line ministries to then report their progress. One of the mission what is mentioned in the midterm development plan is to reduce the stunting prevalence. So and other thing is that we have the target to reduce the wasting, underweight, overweight, and also malnutrition, especially for the children under 5, and for the malnutrition for the women. And we have this logical framework to be the reference for all line ministries and also the subnational government until the village government. So we have this one framework that we use to make sure that each intervention from each institution is reported through the working group. We have the working group within the national level, the subnational level, under the village level. And it's we have the meeting in quarterly every year, and we have the report by the end of years, and that's how we then monitor the progress of each contributor. So and all the stakeholders is within the working group. And that's why if there's any problem in the implementation year, or we then prepare the solution together in the meeting and then accelerate the implementation if it's not working well in the field. So I think that's how we work. And maybe because there's so many line ministries contributed to the nutrition intervention, the responsibility of Ministry of National Development Planning is to make sure that we are still in the corridor. Sometimes the intervention is not in the framework that we built, and then if it's a bit biased, we then ask them to then focus to what we have planned in the first years of plan. I think that's so a regulation in the national level, subnational, and the village is what is important for us as a commitment to make sure that our target is achieved. Thank you.
Thank you, Ms. Dia. I think this is quite important to note how you're integrating and creating avenues to be able to coordinate actions, monitor impact. So I think this is great lesson learned. Thank you for this. Amir, let me move to you in terms of in what ways can nutrition-sensitive social protection programs also build climate resilience among vulnerable households, particularly given the increasing climate and disaster risks facing countries in the region. And in this case, I'll also leave a few minutes afterwards for Ms. Dia to come in, as I understand there's some specific examples in Indonesia that could be shared. Thank you.
Yeah, no, of course. Thank you for the question. So you're absolutely right. I think across most of our member countries, across Asia and Pacific, and particularly in Southeast Asia and South Asia, including countries like Philippines, Bangladesh, Pakistan, and Nepal. Climate change is clearly a growing threat to food security and nutrition, and some of these countries face the highest levels of climate and disaster risk globally. And I think climate change disrupts food systems and nutrition in a couple of ways. Firstly, it's reducing locally available food due to damaged crops and declining agricultural productivity, but it's also driving up food prices through supply chain disruptions. And of course, it limits both physical and economic access to nutritious food. And these impacts are particularly harmful for women and children. So there is a need to I think do more. There are a few good examples from the region. I'll share just two, one from the Philippines and the other from Laos. So in the Philippines, the government, as I mentioned earlier, launched a new food voucher program to tackle hunger and undernutrition by providing monthly electronic vouchers to households who've been pre-identified as being both poor and food insecure. And these vouchers come with pre-allocated shares or spending across different food groups, including for protein, fruits and vegetables, and carbohydrates. And they're complemented by SBCC sessions. But what I think is making the program especially relevant for climate resilience is how it's being adapted now to respond to increasing climate and disaster risk. So we're working with the Department of Social Welfare and Development to make the program more shock responsive. So for example, we're designing operational mechanisms that would allow top-ups either in anticipation of or immediately after a shock and disaster occurs. And that way households can continue to afford nutritious food even when markets are disrupted or incomes fall due to climate shocks. We're also looking at ways to link the program with early warning systems and climate risk information, which would allow more timely adjustments in coverage and benefit levels, or even redemption mechanisms during droughts and typhoons and other climate hazards. And then beyond the transfer itself, we're working to enrich the nutrition education. So we're helping to introduce modules on home and community gardening, food preservation, and seasonal meal planning. Sort of simple but powerful tools to help households make more better informed decisions in the context of climate change. And lastly, we're helping to design and introduce productivity enhancement sessions to complement the food vouchers that would allow households to acquire skills needed for climate resilient livelihoods, including in cases of small scale agriculture, food processing, or other sort of sustainable income livelihoods. Similarly, in Laos, we're supporting the government to make its social protection programs and systems more adaptive. So one of the innovations that we are working with the government on is a climate responsive poverty graduation program, which is specifically targeted to rural women. And this program builds on the traditional poverty graduation model, but adapts every pillar to address climate and disaster risks, including, for example, targeting, where we combine climate risk and vulnerability assessments with data from the socioeconomic registry to select eligible beneficiaries and then match them with viable climate resilient livelihoods. And women are then provided with skills training, coaching, and mentorship, as well as livelihood grants to help them pursue more climate resilient livelihoods, get access to drought resistant inputs or tools for sustainable farming practices. And we're also helping them introduce and integrate context-specific nutrition SPCC that helps families make better dietary decisions, even as environmental conditions change. And then similar to the Philippines program, we're embedding shock responsiveness into the program design to ensure that support can be scaled up in the event of a flood, drought, or other crises. So I guess in summary, social protection programs can build climate resilience and promote nutrition when you help countries move towards more adaptive and shock responsive designs. But you sort of have to design these programs with nutrition in mind, with climate resilience in mind right at the outset. It's much harder to retrofit programs to meet those objectives. Thanks.
Thanks, Amir. And maybe we start moving to the Q&A session, but in terms of that conversation, maybe Ms. Dia, if you want to take 1 minute to maybe touch upon the climate resilience of the programs in Indonesia.
Yeah, I think what Amir has already explained is also implemented in Indonesia. But because I'm in the Ministry of Development Planning, so we have the plan for the climate resilience development, and then we have the low carbon development initiative, which also integrate with the climate resilience plan, and then also for the disaster risk financing, we have also the plan. So with the plan, if there's a shock happen, then we can adapt. We have the adaptive social protection program, where if the shock happen and we have certain condition of the affected group, affected community, so the activities that already stated in the plan is then activated, then to be provided to the affected group. So what we prepare is a very adaptive and shock responsive, and also for the financing, as I agree that the scheme, the concept that Amir has already explained is part of our program also. So I think I then would like to highlight that for us in Indonesia, because we have 7 big islands, we have different types of social and cultural, a variety of social culture conditions. So situation analysis within the community is very important, and then the government will respond, and we have the cadre and the facilitator until the family level to make sure that the family is resilience to then respond to shocks condition, especially for the impact of climate change, and then disaster, because Indonesia is also a country with a very prone area. So I think that's from me. Thank you, Juanita.
Thanks, Dia. And I think just to quickly mention a big impact that if well embedded in the design is, of course, also on gender. There are some countries that are also not just focusing on nutrition, but broader early childhood development. This includes Malaysia, Thailand, and others, where also the focus is on including and strengthening the role of fathers and male caregivers in making sure that children are eating nutritious foods, and this can actually have transformative gender impacts. Let me move to the Q&A boxes. Some questions have been answered. We have a little bit less than the 20 planned minutes, so we'll try to also type in our answers. But maybe to Richard, I think you mentioned the out-of-school children. Can you talk a little bit more? I think there's a question from Manisha. Would love to hear more about out-of-school children, school meal program. Is there in any country in South Asia that is implementing this, or if anybody else can come in? Richard, over to you.
Thanks so much. Well, I'll also invite other panelists to contribute. There are a number of strategies. I think one of the responses already has pointed out that school meals can be used as a way to encourage families with children who are out of school for different reasons to attend. A number of countries have relaxed their policies on age, because one of the phenomena, maybe it's more true for Africa than Asia, but also significant, is that girls who become pregnant are often forced out of school and do not find it easy, not enabled to return to school after giving birth and having young children to take care of. So the school system can be used as a way to reintegrate girls and young women back into education after pregnancy. A number of countries, as well as a shock response mechanism, have provided school take-home rations to pupils at holidays or even at weekends in times of crisis. And I think generally there's options and possibilities for the school system to reach out to parents whose children are not in school through a series of incentives, including school meals and school stipends or pupil-based stipends, to encourage them to reintegrate their children into the school system. Others may wish to add.
Thanks, Richard. And I'm also seeing Tahir Nawaz has, I think, included some examples of this from the experience of WFP Pakistan. So thank you so much for that. Let me then maybe just ask everybody a quick round of, there's a question around what are some of the major challenges you or others who are attending this webinar, who can also type in, have faced in integrating nutrition into SP programs. I think you've all mentioned a few challenges, but if there's one that you couldn't because of the time constraints, or one that, you know, really was a sticking point, or, you know, that you really had to go back and, you know, try again, if we can do a quick round before we hand it over to Bob.
Shall I just go very quickly?
Go ahead.
Thanks. It's awareness of nutrition, both as a critical issue for human development and future economic growth, and combating the assumption or even the myth that increasing household incomes or increasing household food production or food availability will automatically solve malnutrition or prevent it. As I tried to show in the pathway diagram, which was complex, but that reflects the reality of the complexity of nutritional outcomes. Food and income are necessary, but not in many cases sufficient conditions for ensuring good nutritional outcomes. So that easy assumption, you know, households getting better off, therefore malnutrition won't be a problem. That has to be contested, and nutrition has to be therefore built in. And I think Amir gave a fantastic summary of the ways in which it can be built into social protection design. Thanks very much.
If
Amir,
I
over
may
to you.
add.
Yes, Dia.
Okay, so maybe I would like to highlight that cross-ministerial and cross-sector development stakeholder collaboration plays important role, because through coordination and we agree who will be responsible as the leading sector, we can share data, lesson learned, and align the monitoring system. So we have the same understanding of the agenda that we want to work together. And also the intervention can be more significant for targeted groups, especially for the intervention for nutrition, and making sure that the system is aligned. For example, there might be an integration of the food system, the environmental system, the nutrition system, the health system. So with the collaboration, we can then share and then prepare the commitment, what we would like to focus and prioritize in every year of development intervention in the government and for the community. So I think I would like to add that. Thank you, Juanita.
Thanks, Dia. Amir, I think you wanted to come in also.
I'll just go very quickly. I mean, I think I would maybe bucket it into the challenges in three. One is sort of the policy, fiscal, institutional challenge, and you know, when fiscal constraints make it difficult to ensure that, you know, programs have adequate benefit levels, and that, you know, nutrition really does require high level ownership within government, and really champions that at the highest level, to make sure that, you know, different ministries and agencies and development partners are coming together to really work towards a common objective. So that's the sort of policy, political economy, and institutional constraints that we sometimes see. because of so many competing priorities. The second is, I guess, in terms of system level challenges, there's, we see a lot of fragmented and siloed systems, not just within social welfare, within social protection, but certainly lack of integration across systems owned by ministries of education and health and agriculture, and so that makes it very difficult to coordinate. And then I guess last challenge is related to the programs. I mean, some countries just don't have programs in place to target the most vulnerable, and so I think those would be sort of my three types of constraints that we see.
Thanks, Amir. I'd really like to echo some of the ones you've mentioned, ones that we are encountering at the moment. Also relate to just the agreements, data sharing agreements, for example, between the health ministry and the social protection systems. How do we really make sure that we can, whoever we're transferring money to, is this the same person that is receiving the nutrition packages? See these linkages, which also then become, how are the MIS systems linked? Can they talk to each other, and what actual permissions are required to make sure that the data sharing can happen? It looks easy on the design, but when you go down to the bottom, it might take months to actually have this conversation. So I think this, this is also a very useful point, and perhaps maybe also to mention a challenge. When thinking at scale, right? Sometimes, and we're seeing it right now we have 60 big blocks of low-cost flats, and different NGOs are implementing different nutrition programs in each of them. And when you think about scale, then you really need to think, okay, what program design in terms of nutrition works for all, what can be scaled, etc. Mr. Vikar, would you like to mention one last challenge before we move over to Bob?
Okay, thank you. Yeah, I would like take the most that kind of a challenge that is the coordination, because it's a multi-stakeholders program, and then we have provincial governments and regional government. We have 4 provincial governments and 2 regional governments who are part of this program. Although we have signed MOUs with them, but sometimes the coordination is not that effective with them regarding some fine tuning of the program, or some like changing an implementing partner by the World Food Program. We witnessed some a little challenge in one of the province, where the World Food Program wanted to engage another implementing sub partners. And we faced some resistance from one government, and because the new partners were they found it quite hard to get the NOC from the provincial government. So in the future, I see it as a major challenge regarding the smooth implementation of this program in the long run.
Thank you, Vikar. I think let's try to type in as many answers as we can on the Q&A box. And thank you, everybody, for this great discussion. And let me pass it over to Bob to close this up.
Thank you very much, Juanita, and distinguished panel members. This was a very rich discussion. And in the remaining 5 minutes, I will attempt to summarize some of the key points you brought forward, but also think of how we should actually strengthen social protection systems and programs for supporting nutrition outcomes based on the kind of idea, the key ideas that you've identified. So one thing was mentioned, that social protection doesn't always incorporate nutrition goals, and it's important that it intentionally integrates nutrition outcomes into its sectoral objective and strategies. And in that sense, sectoral strategies are important. So the overall national commitment to nutrition, as we heard in Indonesia, is important, and that gives way for integrating nutrition into specific sector strategies. And we also heard that nutrition should not always be attached to health, but there needs to be a broader sort of array of sectors that include nutrition outcomes in order for public policies to be effective. Another thing we heard was this very helpful conceptual distinction between nutrition sensitive and nutrition specific programming, and nutrition sensitive being intentionally integrating nutrition goals, tackling drivers of nutrition insecurity, and introducing nutrition specific indicators and monitoring and evaluation systems. And this is very important because when we think of nutrition specific programs such as, say, food fortification and so on, these are important, but these are unisectoral, and therefore nutrition sensitivity helps us to integrate nutrition outcomes across a range of programs and be much more effective in dealing with them in a multi-sectional way. Now, moving forward, in terms of the specific focus on social protection, what we also heard is that, yes, social protection on its own can be very effective, such as cash transfers and food transfer programs. They can be effective in enhancing food security and therefore nutrition outcomes, but that is not always the case, and enhanced food security does not always necessarily translate into better nutrition outcomes. Therefore, nutrition-specific programs that integrate various components in addition to cash or food transfers can be more effective in bringing about those outcomes. And those include, for example, complementary programs that have to do with awareness, behavioral changes, as well as vaccination packages such as the conditionalities in the BISP case. Design is extremely important, and there are a number of design considerations. We heard about targeting, so not only poverty targeting, but also nutrition targeting, eligibility criteria that focus on children within the first 1,000 days of their birth, but also on pregnant and lactating women. And gender is extremely important, and I'm glad Juanita brought that issue about the need to recognize women as making decisions, nutrition decisions, and empowering women to make those decisions without any inhibitions is extremely important and should be part of program design. M&E and monitoring and evaluation has been mentioned by all panelists. And it's important for recognizing the existing nutrition vulnerabilities. It's also important for evaluating and understanding where we did well and we didn't do so well in order to improve future programming. Pilots are important, as was the case with BISP in Pakistan. In terms of implementation, intersectoral coordination is extremely important. Again, as we try to reach that kind of partnerships between different sectors and different agencies, as we heard, but also partnerships with broader agencies and stakeholders, not only within a country, but also development partners. Again, the Pakistan is an example where different stakeholders collaborate on nutrition. And finally, in terms of implementation, I would say, so the outreach capacity is very important for reaching out to remote populations, but also to excluded groups, as well as incorporating climate change considerations into program design, shock responsiveness, early warning systems, integrating climate considerations into livelihood and economic inclusion programs. So there's a range of different issues that one needs to pursue and needs to address in order to enhance social protection, broadly defined as a way of tackling nutrition outcomes. So with that, we are about to close this webinar. I would like to thank our participants and panelists for their rich presentations and contributions. I would also like to thank participants online for their questions and for being with us for the past hour and a half. And big thanks to socialprotection.org for helping us to host these webinars. Thank you very much. And as I said, please look out for future webinars. As this was the first of the webinar series that the ADB is hosting, there will be more interesting and exciting webinars, and they're all very complementary. And we're bound to hear more about nutrition, shock responsiveness, adaptability, and other themes that I have discussed in this webinar. Thanks again, and all the very best to you.
Thank you, Bob. Thank you, everyone.
Thanks,
Thank
Bob.
you.
Thanks,
Thanks, everyone.
everyone. Bye.
Thank you.
Thank you.
Bye.